We're talking teeth, and we're talking your smile. And summertime, everybody's out. Everybody wants the smile that maybe they didn't get graced with at birth, but you sure can have it these days for a lot less than you think, as far as effort, as far as even money and time. You can have it. We were looking at just the veneer change, not to mention just 1 or 2 teeth when it comes to implants.
Right.
So, Doc, what's nice is that we're talking about the fact that people are coming in who may have been living with some of this for a long time thinking, oh, I've had it, I've never been happy with my smile, what can you do for me?
You'd be amazed at how many people are out there that have that same attitude. They've lived with it their whole life, and they wish they could have got it done sooner. It's the money, it's the fear factor. They're afraid to go to the dentist. They really don't need to be afraid, because we try our very best to make it a very comfortable experience for them. And as far as the cost goes, we have financing options. We can spread it out over 2 years with no interest.
Right.
We can go up to 5 or 6 years if you need to if it's a larger procedure and you really need a lower payment. But we work with our patients to make it affordable for them, to make the payments affordable or work out some kind of payment plan. But the procedure is simple. Whether it's replacing 1 or more teeth or doing cosmetic veneering, it usually takes 1 or 2 visits. They're painless, and the patients can go out and usually eat the same day.
Let's even talk about dentures for a second, because you may have dentures that you've always just been used to putting it in. It's got the artificial palate. It's a big deal. You know what? You could talk to Dr. Shatkin about getting a few teeth put in, like implanted molars or whatever, as anchors, and then you could snap in your dentures and have your own natural palate. How awesome would that be?
We do that all the time, Linda. We cut out the roof of the mouth on the plastic. So
don't move anymore.
We don't cut the palate off of the patient. It's off of the denture.
Off the denture.
We take the palate off the denture so it opens up that space, and they can taste their hot and cold liquids. They can taste spicy foods, or
and you can do that
whatever.
at any age. Don't ever think you're too old for that.
If they have a full upper denture and they don't like the palate, or they have a gag reflex, we cut it off. We put 4 to 6 mini implants in, and in 1 visit we can snap the denture in about an hour. They can have the procedure done. On the lower jaw, where people have trouble with the lower denture slipping and sliding, we put 4 mini implants in there, and it snaps in, and it's very secure, very comfortable.
And when you smile, I mean, just how cool is that going to be?
But not only that, they can bite into corn on the cob and apples, and
they do feel like your teeth.
And steak and all that stuff.
All right, we have one more case we want to show you, and it's another veneer. And we want to show you what can be done.
So here's a case of spaces between the teeth, discoloration. The teeth are kind of flat and worn down, and these teeth were already large in size. So we had a challenge here to make these teeth look symmetrical size-wise and make them not look overly huge. And so the next slide will show the result we have with this. So here I'm sorry, this is the retractive view showing the teeth, and you can see he had very large front teeth. And the next one will show with the veneers on.
Wow.
And you see what an improvement. What we did is we made the laterals and the canines bigger, so that we can make the central smaller and also close that space in the middle.
I see exactly what you did. That's amazing. And again, it looks like that the 2 front teeth are actually smaller than what you started out with.
They're smaller than what they started with. Go to the next slide.
We have another one, another finished.
We'll show the final.
Yowzer. There's the smile that he's been hoping for his whole life, and there it is. And again, it can be done.
And this is not just for women. These were 2 examples of men who had unattractive smiles and wanted them to look better. So of course, we do treat more women for cosmetic dentistry because that's more on their mind, but more and more men are also coming in for these procedures.
That's great. And we have more and more people who are starting second careers. And this might be the only time in your life where you've been able to say, you know what, maybe I can spend it on me for a change. And this is something that I can fix, and I can go and at least have a consultation and find out what is available.
And that first impression at an interview or whatever is very important. And like I said earlier, if somebody smiles, the impression is that they're a happier person.
Plus, you know what, you're a role model as a grandparent or a parent. If you're not taking care of your mouth, what are you sending as a message to your kids and your grandkids?
Absolutely.
And you can send them a much better message if you're taking care of yourself.
I have patients who come to me that they've had their teeth extracted when they were 17 or 18, all their teeth, and they've been wearing dentures since they were 18 years old. It's very sad.
Yeah, that is sad. We also want to let everybody know that we talked a little bit about your expansion across the street, the incredible lab that you've got going there. you're now going to see maybe some new changes when you drive by the Aesthetic Associates, maybe by the end of the year.
Yeah, by the end of the year we should be breaking ground. In fact, they're there digging some holes today to check the ground, but we're going to be adding a 15 to 16,000 square foot facility adjacent to our existing medical dental office. It's going to be expansion to help provide even more opportunities for our patients and for new patients to come in for anti-aging, for cosmetic surgery, cosmetic dentistry, and all the different things that we do.
There are so many incredible opportunities for wellness these days that work with natural, works with the modern medicine, it works with dental techniques, and that's what they're going to specialize in. So best of luck with that.
Thank you.
You're welcome.
My brother and I are very excited about it.
You should be. You guys are moguls. It's all happening, and good luck with your laryngitis. But we want everybody to call the Aesthetic Associates Center. Dr. Shatkin does incredible work, and he can give you that smile that you've always wanted. As they say, smile with confidence at the Aesthetic Associates Center.